Let's flip over to compensation and benefits. As y'all know, we talk about this at this LDI every year because there's changes coming. We've spent several of the last months, a lot of the last several months, working on just trying to make sure that we're fulfilling our commitment to total comp and benefits, to a competitive package in that arena. And SLT does a great job of really leading that effort and making sure and asking hard questions, making sure we're doing what we need to do in this arena. And so we're going to spend a little bit of time talking through what we're going to do to make sure we fulfill that commitment to a competitive package for our folks. So we'll start with compensation. One of the things that we heard in the survey, even in the belonging survey, was this idea of compensation and feeling like you are being compensated for the work you're doing, and that I think for a lot of people, this is where you feel value, because it has some real impact in your everyday lives. So I want to, as we talk about this, I want to make sure and just ask y'all in advance, take this message back to your teams. Talk about this conversation in your teams when you have your next staff meeting, because some of the feedback we're hearing is we never hear an update on compensation. And I think the way we do this to a large degree is we talk about it here and we ask you to take it back to your teams. Please take this back to your teams. It's really important that they hear this from you and they understand we really are working on it, and that we look at it. So here's what we want you to share. Every year, for every position in this system, we look at market data. And the way we do that is we pull information from other Texas employers. We look at national employers. We look at big healthcare systems, small healthcare systems. And basically what we're doing is looking at what are the people who are employing this same talent that we're trying to find and bring the best to United Regional. What are they paying? And are we competitive with that? And so we spend quite a bit of time over the course of about 2 or 3 months working on gathering all that data for every position in the system. So we do that. Phyllis did a great job of summarizing this process at forums when she talked to us in September. So I'll give just a brief overview, but I want to make sure we go through that. So we match our jobs to those of other employers. This can be a little bit of a process, but I think we finally figured out how to do that because different titles do different things at different places. But we match all that data together, and then we look at, okay, what's happening in the market based on these surveys. So these surveys are gathered from other employers who submit data to these surveys because they're doing the same thing we're doing. And so we make sure that we use valid surveys. A lot of times what I hear is, well, I went to salary.com. Or I went to Indeed and I tried to see, what my job should pay. And that's a marker, but it's not the gold solid standard always. And so I just want to make sure that as people are looking at data, bring those questions to me. Let's have a conversation around it, because some of those sources are valid, some of them are not. And that can really have an impact on how people feel about their work. So if they have a question about it, let's talk about it. But what we do is we look at which jobs need to move to a new grade. What do we need to do to our grades itself? Because you guys all know we've had some cost of living adjustments over the course of the last few years, and I know the Fed's working on that, but that's something that we look at. We have conversations with leaders about, okay, how has this position changed? It looks like market data's changed, or you're hearing some feedback from your staff that it's not where it needs to be. Let's talk about that. Has the job changed? Have they added new duties? Is there a new certification that they have to have, or a different level of education? Or maybe they have more employees. They used to have 1 and now they've got 10. So we look at all of that stuff, trying to make sure we're doing a good job of comparing. Next thing we do is we budget for it. And so Bob and I have lots of fun conversations about, okay, how much do you need? Are you sure you need all of that? And we try to get to a very reasonable place on here's really where the market's moving. And at the end of the day, we budget what we need to make sure we're fulfilling that commitment to stay competitive. And I appreciate that. And I don't know that everybody understands that's a big number. It's always a big number. And Bob always does a really good job of making sure we're financially strong enough to manage that number. And so I appreciate that process, and I appreciate the commitment from our senior leadership team to make sure we go through that process. And I don't know that everybody appreciates that as much as I do, but I think it's worth mentioning. So we budget for it, we've done that. and then we roll it out. So that's right about where we are. Oh, my font didn't come through. Sorry, that really was much cuter on the one that I did. We're right about here is what that says. So we're going to talk about this. So market adjustments, what are we doing? The on-call standby pay rate is going to increase to $3 an hour. This is really just a payment to stay available if you need to work, if we send you home or whatever. So that's increasing. We have about 238 positions where there's either a change in the grade or the grade is adjusting, which affects about almost 1,200 employees, so right around that number. So how do we get that word out? So what we're going to do is the week of January 15th, we're not at Oracle yet, so we are still with Secure Sheet. We're going to share market adjustments via Secure Sheet this year just because it's a little bit easier for us to manage on the HR side. But you'll get your login. If you already have your login, that login should still work. But we'll go through the process of updating that, getting you guys access to the system that week of January 15th, somewhere in that week. What we're going to ask you to do is sit down and have these conversations with your staff, one-on-one if at all possible. Have those conversations with them and just kind of reinforce what we just talked about. This is what we feel like we need to do to make sure we're maintaining competitive wages for your position, and have those conversations with them by January 26th. The reason we have 2 weeks to do that is because that following week we need to get these in the system so that we can actually pay these raises, which will be effective January 21st and be on that February 9th paycheck. So, any huge questions on that process? All right, I'm going to give I know we're a little bit early, but we're going to talk about performance reviews for a second. These, again, will also still be in success factors, and we're going to use Secure Sheet to do the calculation. We're going to do a little bit different timing, and so those of you with a lot of employees, I want to kind of get your attention. In high school, I used to have this teacher that used to work at NASA, and he was this short stature man, very, very military, very old school, and whenever we would be in class and he would say something that was going to be on the test, he'd do this thing, and we knew we needed to pay attention. So I need you to pay attention. March 1st is a little bit later than normal, but March 1st we're going to open up success factors, and that'll give you a chance to get in there and start entering the data on your performance evaluations for your staff. Give you about a month to work on that. April 1st, of course, we'll leave Secure Sheet open, but that's when we're going to open up, we'll leave success factors open so you can continue to work on your evaluations. April 1 is when the calculator will open up. So you go in and plug in the score and it calculates the pay increase or the lump sum bonus. That'll be open for about a month. We really need you to be completely done with your evaluations by April 30th. This is a big deal just because of the timing of what's happening with the ERP, with the timing of hospital week coming up, and with the effective date being May 12th. We've got a little bit of a short window to get that done, but what we're trying to do is navigate kind of some of the time frames and the priorities related to ERP and still get this stuff done. So just a heads up on that. Try to make some plans. If you need to adjust some things, let me know. Talk through it, but really, we need those done by April 30th because that's when things that rely on those scores start happening. So just a heads up on that. And then May 31st will be that first paycheck with that increase or the lump sum bonus on it. Okie doke. Benefits. Helping people feel seen, valued, and heard. This is what we hear in the comments. Benefits have a big piece of that, so we spend a lot of time looking at what are we going to do with benefits each year. Again, it all circles around trying to make sure we're offering a competitive package. And so there's a lot of things that go into benefits. Jennifer and Sarah, I think, talked about the achievement piece and the service and the recognition. Some folks consider that as one of these benefit things. But as Phyllis shared in forums, our leadership team has really been focused on seeking and listening to feedback from our staff around benefits. And you'll recall we did that survey back in the fall, I believe August of 2022. Man, time flies. And so we've been using the results of that survey for the last year to really drive and make sure that as we look at the market data and figure out what are other employers doing, what do we need to do to maintain competitiveness, what are the things that employees and people value? Are we spending the money in the right spot? There's market, but then there's also us, and so we're trying to marry those two together. One thing that we haven't talked about much as it relates to the benefits survey, the results from last year, is the good news. And what we were able to validate is that staff confirmed that United Regional is investing the most money on the things that matter the most to most of our people. And, again, I think we always focus on what are the things we need to fix, but this was one of the good things. We really are spending our money where people want it, and that is PTO, pay, medical insurance, and retirement. So there's a lot of investment there, and so I just wanted to kind of mention that. There's some good stuff there that we forget to sometimes think about. So that's where we've been working, is trying to make sure we're beefing up, making adjustments where we need to, but also listening to the feedback to see if there's some ways we can do some things different to make it easier to use these benefits and make them more valuable to our staff. So let's start you'll recognize this slide. This slide's a lot like the one Phyllis used, but I've updated it. So scheduling and time off. In Phyllis's forum's presentation, she mentioned we were doing a lot of work looking at the option of providing sick leave. We had about 54% of our employees say, I want sick leave in addition to PTO. And there's a lot of pros and cons to that. And so we, again, started with market data. What is everybody else doing? We looked at a whole lot of options. We modeled a lot of different options. And at the end of the day, I think where we landed was sick time kind of limits what you can use sick time for. And so what we opted to do is we're going to stick with PTO. PTO is totally flexible. You can use it for your illnesses. You can use it for your kids' illnesses. Use it for vacation. If you're never sick, use it for extra vacation time. Use it to take a day off to go do Christmas shopping or whatever it is that you need to do to rest and rejuvenate and get yourself taken care of outside of work. So that's what we're going to do. PTO does have time built into it, very intentionally has time built into it to cover holidays, to cover illnesses, and to cover these vacations. And so it's built with all of that in mind. And the goal is just to give employees the max flexibility we can give them. So in addition to accruing it and being able to use it for all these things, if you don't use it, you can cash it out. And so that's not something all employers offer. So we looked at that as well. But we do want to continue to offer it, continue to make that flexibility available. The other thing we're going to do is some of the feedback we heard was that some of the policies within the PTO plan are just tough. They're tough to swallow, they're tough to manage, they're tough to navigate. And so we're in the process of going through some focus group discussions with leaders as well as with staff to try to vet through that just a little bit. What are those policy things that we could maybe change that don't necessarily affect accrual, but they may make it easier to use the benefit and find more value from it? So going through those conversations, thank you to the leaders who have participated in those conversations already. We're getting closer. We're just not quite ready to roll out some of those revision changes because we're still gathering some feedback on it. Save the best for last. We are increasing the PTO accrual. Good. We're just going to leave it at that. One of the things that we found is we're going to, so a couple of things on the PTO accrual. We're going to essentially give each tier within our PTO accrual grid about an extra 8 hours a year. So it'll accrue just like normal, but we're going to accrue an additional day a year, basically. We're also combining that 0 to 1 year tier to the next tier. So we'll have one 0 to 5 years of service tier that'll accrue a little bit higher. So I hope that's clear. We'll have more communication coming out on that as we roll out the benefits and the policy and all the different things that go on it. That will happen April 1st. So we always do benefits April 1st, so just kind of watch for that. We're giving you a little bit of a preview on it, but that's coming. Okay. The next thing we talked about, or the feedback that we got from that benefit survey, was total well-being. People want us to focus on total well-being. So about 23% of our employees who responded said they wanted a concierge program on site for just convenience. And so we're going to try it. I'm super excited about this. You know, ERP is not so much fun. There's different things that I do that aren't so much fun. This one's kind of fun. So we are, and you'll see it in the Pulse today, we're going to do a 6-month pilot for a concierge program that's really going to start in January. I just hired someone to kind of help manage that. They will start and try to get this program up and running sometime in January. Kind of as a prelude to that, we are going to offer gift wrapping next week for a limited time. It's like 20 people, 20 to 25 people, up to about 5 packages a person, but just to kind of offer some convenience, take some of that load off at home to make it a little bit easier to focus at work maybe. So anyway, the things we're thinking about offering with this concierge program is like on-site oil changes. So you drop your keys off in the morning and we'll have somebody come and change your oil, and then you just go home. You pay for it, but then you take it home. And we're probably just going to do credit card. You know, it's a convenience service. It's not a free service, but it is a convenience service. Maybe car detailing, we're working on that. Dry cleaning, package service. How many of y'all hate returning packages? I hate dropping off packages. They just bring them to work. We'll send them off. If you need to ship a package to a kiddo somewhere, you need to ship a birthday present to a grandkid, if you will, we're going to be able to latch into the hospital's really fantastic FedEx rates and use that to ship packages if you want to do that. The other thing we're going to try to do is like on Valentine's Day. I don't know if y'all are as bad at gift giving as I am, but usually it's Valentine's Day and I think, oh gosh, what am I going to take home to my kids or my husband? We're going to try to offer some services around that where maybe we bring in, I don't know if it's flamingo, or we bring in flowers, or we bring in something that you can kind of order and just pick up on your way home. So some really nice convenient services is really what we're trying to do to kind of help with that work-life balance. I joke about this a little bit, and maybe I shouldn't, but about 80% of our population is female. And moms, I don't know, I feel like sometimes we get stuck with all the gift stuff. And so I hope this helps create some balance. Good, I see some happiness, good. One of the other things that kind of goes with total well-being, well it does, is we are also going to review the Be Healthy program in 2024. We got a lot of feedback, don't change that, we like it, we like the incentive, but then we also got some feedback that said, I think you maybe need to tweak it a bit. So there's a group that's going to be coming together, pulling in physicians from URPG, pulling in different people from different areas around preventive care and mental health and benefits, of course, different places, but we're going to review that program and see if there's something we can do. One of the things we're also going to do starting in January is we're going to put your wellness screening results into MyChart. Yay, I know. So lots of thanks to Amy and her team and Matt Marshall and his group for really working on that and making all of that happen. I feel like I've forgotten someone, and I'm sorry if I did, but we're going to continue to work on that. We've also, I want to make sure, I know we talk about this a lot, but I also want to talk about EAP a bit because there's a lot in here. And I think a lot of times folks have a hard time focusing on work and finding that spark when they've got something really big that they're dealing with at home. And so I want to make sure everybody, again, knows this program is available. We have BetterHelp, which is text, in-person, video, all kinds of counseling available through BetterHelp. 5 visits per person, per issue, all year long. So have your 5 visits about your teenager kid that comes in and walks up and wakes up in the morning with all the grumpiness in the world. Get him figured out. Then you can work on your husband. Then you can work on you. Then you can work on, but lots of access to some counseling. NeuroFlow is a kind of a self-care app that can help with things like insomnia, anxiety, depression, substance use disorder, lots of things there, but it's more of a self-help app that you can use. There's lifestyle coaching. If you've got a thing that you're trying to change a habit, maybe it's you're trying to get to the gym and you just need somebody to hold you accountable or to encourage you. They have lifestyle coaching that can help for like about a month with let's just get you where you want to be on this thing. Not counseling, coaching, which is a little bit different. We've got in-person counseling. LifeMart, I don't know about y'all, discounts are fantastic through LifeMart. Depending on what you're looking for, you can get discounts to vacations for washers and dryers, for tires, for oil changes. I mean, I think there's like 10,000 vendors on there where you can get a discount through this at no cost. My Secure Advantage is one that I don't think we've really talked about much, but this is financial coaching. And much like the mental health counseling, this financial coaching is where you can actually make an appointment, an in-person appointment with a financial advisor or a financial coach. And let's just say you have a question like, how much do I need to be saving for retirement? Or I've got this credit card debt and I don't know how to get out from under it. Or I've got a kiddo that's going to college and I'm not quite sure how to navigate that with the rest of my life. These guys are really great. It's all offered at no cost to employees, and it's really easy to get through from the website and really get you some meaningful help for some of those things that probably keep many of our employees preoccupied when we really need them focused at work. So really good tools. So just want to make sure we brought that up again. Oops. Family care. Okay, this one's a little bit tougher to talk about. This is one that comes up pretty frequently, is this option of a daycare facility. And you hear employers here and there who offer a daycare facility at their location. So we heard this, SLT, heard this request, really took it to heart, and we did a lot of work. So what we did is, kind of what Phyllis said, is can we do this in a way that makes sense? Can we figure out this daycare piece? And so we hired a group called Bright Horizons and asked them to just do an analysis. We want you to look at our community, at the demographics within our community. We want you to look at the daycare options available. We want you to look at where our staff live and what that looks like. Oh, and here's our crazy schedules that we run and all the different hours that we would need coverage. Here's what demographics are for our employees themselves in terms of here's what they get paid. Here's the hours they work. Here's the jobs they run, number of kids they have. And so we tried to look at everything. Pulled in folks like Jesse and said, Jesse, okay, if we were to pull in a daycare facility, where in the heck would we put it? Because on-site is one of the things that people really have, employees have given us feedback that they would like to see. So Jesse was involved, Christy was involved, presented to SLT the findings. And Bright Horizons, because they're the experts, we wanted to get somebody who knew that business, knew the regulations around daycare, who could really give us some really good, thorough insight on it. And so they came back and they said, okay, here's what we think reasonably you can afford, or what we would suggest for a group your size, not what we could afford. Here's what we would suggest for a group your size. Here's what we would suggest based on your community as far as premiums and tuitions go. Here's what we think we could offer. Here's the hours we think. Here's the facility size and all the things that we would need. And they came back and said we can do about 40 kids, which is less than 40 employees probably. The cost of that program would come at a very high price tag. In like first year, it's going to be like $1 million or more. I mean, lots of dollars, and it would be an ongoing subsidy that the hospital would have to invest in a daycare facility to make it viable. And so at the end of the day, lots of discussion trying to figure out, does this make sense to offer? And we decided it really doesn't. It doesn't make sense to try to spend this kind of money to benefit less than 40 employees. And so I know it's not the decision any of us wanted to get to, but from a reasonableness perspective, we've decided not to do a daycare. So questions on that or? Okay. Next thing we talked about was medical plan. I think Phyllis talked about a lot of this, so I won't spend a ton of time on it since it is 12. But just to remind you, and we'll do some ongoing communications on this. I've got a project in the works right now to talk about with employees. We offer a 50% discount at United Regional, straight off the top. What I think happens is employees don't see it because it all happens on the back side. How many of y'all love reading an EOB? How many of y'all even know what EOB stands for? It all happens behind the scenes, and so employees don't necessarily see that. So we're trying to figure out how do we communicate this better to our staff to let them know you get a really good discount when you come to United Regional for your care. When you go to URPG to see that doctor, you're getting an excellent deal. It's not free. probably not ever going to get there. Healthcare is too expensive for that, and we've got to remain viable as financially. So just wanted to make sure we talked about that. That's there, so that's good news. Education, you guys all know, at least you should know by now, we increased our tuition reimbursement allowance. Earlier this year, we did that back in April. We expanded our school-to-work eligibility, and so we actually have almost tripled the number of people in the school-to-work program. So these are people going to nursing school that at the end of it have about a 2-year commitment to come to our organization. It's a really great feeder to the apprenticeship program, and so I'm really excited to see that expanded eligibility really increased participation. We've also seen a little bit of a pickup on the public student loan forgiveness program, which, because we're a nonprofit organization, if you have student loans, a lot of those loans can sometimes be forgiven if you meet the criteria. Criteria is a little onerous, but we can help you with that if that's something that you've got tuition loans that you maybe want to look at. Is there a way to get some of that waived through the government? Really cool program. And then the last thing we've already done is financial protection. We had quite a few employees, or about, I think it was, make sure my number's right. Yeah, 34% wanted an after-tax or a Roth retirement plan option, which we did. We offered that earlier this year. So basically, you can save money. The traditional way that we've been doing it for years is pre-tax, and then when you pull that money out and all the earnings, you pay taxes. Or you can put your money in after tax now so that when you pull it out on all the earnings, you don't have to pay taxes later. So it's kind of a game of, is it better to pay taxes now or pay taxes later? I can't make that decision, but it's something that people wanted and we made available, so that's there. We also shortened the vesting period. So when you put money into your retirement savings account, the hospital matches that. It used to take 5 years for that match to become yours. Now it's only 3. So another good thing. But then the other thing we also look at every single year is our match competitive? And it is. I think sometimes what happens when people start talking about retirement plan match, they hear, oh, this employer matches up to like 8% or up to 10%. What you've got to really dig into is a lot of those employers are doing a 50% match up to 8%. And so it all comes out to 4%. We're just doing it all on the front end, which I think is a good thing. It's a good message. Still want you to retire and with dignity and the amount of money that you need to have. But so save more. I'm always going to say save more in your retirement. You'll never regret it. But we do have a very competitive match, and just want to make sure you guys are aware that we look at that and we know we're in a good spot. Okay. So those are the bulk of the updates. Any burning questions, or feel free to come ask me afterwards if you want to. We'll start rolling all of these communications out pretty quickly, but some of the other annual benefits enrollment changes that'll happen, all of this goes into effect April 1, is of course medical premiums are adjusting. We should have a very keen awareness of this because we all know we're all getting raises through the merit increase process. We're doing market adjustments. Medical care isn't getting any less expensive, and so we've got that affects our rates. One of the things we are changing, though, is many of you may know this. You may have staff who we have a lower premium rate on the medical plan for employees that make below a certain amount. So if it's just you covering and you make PCAs, housekeepers, that's usually where this hits. That rate's going from about $21.57, where we draw that line, up to about $24.24. And all of this is based off of ACA affordability and things, but this is, for that population, this is a really important number. And so that's raising by about $3, which I think will be pretty significant, just to make sure we're staying compliant with those rules. Dental premiums are going to adjust just a little bit. Vision is covering standard progressive lenses, so that's a little bit of a benefits improvement for those of y'all that are at that stage where you need bifocals. I'm sorry. I am in that group now. Flexible spending, we have a new grace period that kind of gives you a little more wiggle room at the end of the plan year. So if you get to the end of March and you're like, oh gosh, I've still got money sitting in my flexible spending account, you've now got a little bit of a grace period to figure out how to use that money. And now you can go get a new pair of glasses or go get your prescriptions filled, whatever it is. The max is increasing to $3,200 a year, but really that's the bulk of the changes. That's kind of it, in addition to that PTO change we talked about. So good news on the benefits front. Benefits enrollment is coming up, so February 1st through the 15th. You have an opportunity to change whatever you need to change on your benefits for the year just because you want to. Outside of that, of course, you've got to have a qualifying life event. If you get married, you can add your spouse. If you get divorced, you can drop your spouse. This is your window to do whatever you want without one of those qualifying events. It is going to be a passive enrollment, so unlike last year where everybody had to enroll, this year you don't have to. If you don't want anything to change, you don't have to touch it, with 2 exceptions. So that's what's noted here. You do need to fill out and update that online surcharge questionnaire, so we'll send out a QR code. We'll make that real easy for you to do. It'll be actually in the enrollment system too if you want to where you can link out and go get that filled out. And then flexible spending. If you participate in that program, we're required to make you re-enroll every year, so that'll happen. But other than that, if you don't want to change anything, you don't have to, which is kind of nice. Wellness incentive, that same February 15th, 1st through the 15th window, we're going to give you a chance to, if you totally missed your wellness screening last year or earlier this year, you've got this 2-week window to get it done if you want to earn the incentive. Or if you didn't do so hot on the first screening, you've got a retest opportunity here. And then just a reminder, if you haven't turned in your verification of annual physical, get that in by the end of January. Because this is a passive enrollment and because you really don't have to make changes, we're not going to offer that opportunity in March to make changes and correct what you messed up. So if you are one of those, and I know there's some in this room that I reach out to every year and say, hey, you haven't enrolled yet. Do you realize you have no benefits? I'm not going to reach out to you. You're going to have what you have, okay? So just a heads up on that. If you want to make changes, please encourage your staff. Get it done during this window, this 2-week window. But any questions on that? All right, good stuff happening.